No pulse. We need some help in here. Let's get her positioned better on the bed in the count of 3. 1, 2, 3. All right, let's get her hooked up to the monitor. Go ahead and start an IV. I need somebody to start CPR, and I need the intubation tray. I'm not sure how you get to the decision to put the paddles on your chest and discharge them, but she did.
Dr. Clower's patient used a defibrillator on herself, which put her into ventricular fibrillation. Her name is Alyssa. She's a dancer. It all started with a twisted ankle during a performance, and while waiting in the ER, she took every chance to entertain everyone, though clearly not something kids should be watching. That night, the hospital was extremely busy, and the resuscitation room was the only one available. So to keep her from disturbing other patients, Dr. Clower had no choice but to move her there.
Hi, I'm Dr. Clower.
Alyssa, nice to meet you.
Tell me what happened with your ankle.
Alyssa said she stepped on a beer bottle while performing, and Dr. Clower's exam suggested a possible ankle sprain, though a fracture couldn't be ruled out. Even on the hospital bed, Alyssa couldn't sit still, constantly touching the medical equipment around her.
Hey, you don't do that. I can't have you touching the equipment.
Normally, I'm the one who says no touching. Ah!
I suspected there might be a little alcohol involved.
Dr. Clower asked a nurse to take an x-ray, and that's when Alyssa picked up the defibrillator again, only to be stopped immediately by Dr. Clower. Just then, a nurse reported another patient had been impaled by a shovel, forcing Dr. Clower to leave and check on him, but not before warning Alyssa not to touch any medical equipment. But if disaster is possible, it never misses its chance. Not long after Dr. Clower finished treating the impalement patient, a nurse rushed over saying there was a problem in the resuscitation room. At first, Dr. Clower thought it was a different room, never imagining Alyssa had shocked herself with the defibrillator, and without applying conductive gel pads. As a result, she suffered 2 burn marks on her chest. There was no time to question why she made that decision. Saving her life was the only priority. Fortunately, Dr. Clower knew exactly what to do, and Alyssa was successfully revived. But when she woke up, she didn't even say thank you.
Cute. Let's roll.
Sometimes it's a thankless job, but it's always gratifying.